Hi, I am 7 years old. I live in tropical Africa. One day, I got an unexplained fever, night sweat, and unexplained weight loss. In the past, I was complaining of malaria, but 15 days ago, the chief complaint is a swelling in the lower jaw on the left side. My mother is called Lucy. She told me,
We must see a doctor, my sweetheart. I know an excellent doctor in Benha hospitals. He's a very excellent pediatrician there.
I suffer from lymphadenopathy. Bilateral submandibular lymph nodes are enlarged, palpable, and tender, one on each side, and firm. The left submandibular lymph node is fixed to the underlying structure, while the right lymph node was mobile. Swelling and distortion of the facial bones. Left-sided submandibular swelling rapidly increased in size. Solitary diffuse swelling. The left side of the mandible extends from the angle of the mouth to the angle of the mandible. The surface of the swelling is smooth, stretched, and erythematous. I have palpation in which is a local rise in the temperature and the tenderness. Thanks God, no discharge was noted. Hi, Mom. Have you called the doctor yet?
Yes, and he said that he got your investigations. I am on the way to meet him and got yours.
I'm waiting. Bye. What's happened, Mom?
Your CBC shows leukocytosis. ABV is positive, and your serological tests is alkaline phosphatases and lactate dehydrogenase are elevated. Also, your CT and MRI is hypoechoic swelling at the region of upper deep cervical lymph node. The FNA large are typical lymphoid cells.
What are you saying, Mom? I do not even understand anything.
You don't have to understand, boy. But thanks God, your HIV is negative. And your CT guided biopsy has large cells with hyperchromatic nuclei with polymorphic pattern, occasional mononucleated nucleated cells.
Mom, where are you going?
Your dad is on the way and he's hungry. And I must cook for him. Leave me alone, please. I'm
Mom,
not a doctor,
wait.
boy.
I
But
just
the
want to know
doctor
more
told
about
me to
this.
read this. Lymphadenopathy or adenopathy. It's a disease in which the lymph nodes are abnormal in size, number, or consistency. In general, any lymph node greater than 1 centimeter is considered abnormal. The body has approximately 600 lymph nodes, but only those in the submandibular, axillary, or inguinal regions may normally be bulky in healthy people. Causes of lymphadenopathy may be inflammation or neoplastic. The inflammation may be non-specific or specific, and the non-specific can be acute or chronic. Neoplastic may be primarily lymphomas and secondary metastasis.
What about evaluation of lymphadenopathy, Mom? What about age? What about location? And what about the symptoms? What about the duration? And if it has a longer duration, what happens?
Don't be afraid, my dear boy. Less than 30 years is more possibly to be benign, but older than 50 is more malignant. Location, we have to examine the drainage areas for infection or malignancy. The associated symptoms, presence or absence of splenomegaly. And with splenomegaly, hematological malignancies is suspected. I hope that you do not have splenomegaly, because you are less than 30 years, so it might be benign. And the duration, the evaluation of lymphadenopathy can also give clue about etiology and severity. Longer duration of symptoms in lymph nodes enlargement suggest possible chronic infections like TB or indolent cancers like follicular lymphoma. Malignancy possibilities suggested by symptoms-related mechanical compression like dysphagia, hoarse voice, cough, hemoptysis, and systemic symptoms like weight loss, anorexia, fatigue. Diagnostic approach to lymphadenopathy: first, localizing symptoms or signs, infection or neoplasm. Second, constitutional symptoms, TB or lymphoma. Third, epidemiological, occupational, travel. Fourth, medications as phenytoin or that cause serum sickness-like syndrome. Oh my, what happened there?
For sure, Mom. This is my dad coming from outdoors. What about generalized lymphadenopathy, Mom?
Almost always indicates a systemic disease is present. Proceed with specific testing as indicated. If a diagnosis cannot be made, the clinician should obtain a biopsy of the node. Diagnostic yield of the biopsy can be maximized by obtaining an excisional biopsy of the largest and most abnormal node. The physician should not select inguinal and axillary nodes for biopsy, since they frequently show only reactive hyperplasia. I must go to see your dad.
Please, Mom, I want to know about localized lymphadenopathy. And just do what you want to do.
Oh, my dear boy, I don't have more preachers than you, so I will talk about localized lymphadenopathy. The discussion about when to biopsy is more difficult. The patients with a benign clinical history and unremarkable physical examination and no constitutional symptoms should be re-examined in 3 to 4 weeks to see if the lymph nodes have regressed or disappeared. Patients with unexplained localized lymphadenopathy who have constitutional symptoms or signs risk factors for malignancy or lymphadenopathy that persists for 3 to 4 weeks should undergo a biopsy. Biopsy should be avoided in patients with probable viral illness because lymph node pathology in these patients may sometimes stimulate lymphoma and lead to a false positive diagnosis of malignancy. Sorry, my dear, I must go now to see your father. He must be hungry.
Okay, my loving Mama.